Today I will be discussing lung cancer by Angelique Colley, that is me, in remembrance of my grandfather, Glendon Colley. The reason I chose lung cancer is because when I was about 18 months old, he died of lung cancer, so I wanted to do this to learn more about him and what he went through and just do it in his memory. So, technical difficulties. Lung cancer is the uncontrollable growth of cells. This spontaneous growth starts in the lungs, but more likely than not will travel into the other parts of the body if not addressed quickly. There are two main types of lung cancer. There is small cell lung cancer and non-small cell. Small cell lung cancer is the deadliest form of lung cancer because it's very aggressive. It grows incredibly quickly and spreads in lung tissue to other parts of the body. If this form of cancer is left untreated or caught too late, it could give the individual a life expectancy of no more than just a few weeks. According to the statistics, 95% of individuals with this diagnosis of small cell lung cancer will die from it. There are two types of small cell lung cancer. There is small cell carcinoma and combined small cell carcinoma. The other form of lung cancer is discuss is non-small cell lung cancer. This is the most common form of the disease and makes up roughly 80% of the diagnoses. There are three main types: squamous cell carcinoma, a lung cancer that begins in squamous cells. They are thin, flat, disc-like cells that kind of look like fish scales. They're found in the tissue and forms the surface of the skin, lining of hollow organs, and the lining of respiratory and digestive tract. Most common among individuals that smoke and occurs in 35% of patients. The next form of non-small cell lung cancer is large cell carcinoma, lung cancer where the cells are large and look abnormal. This form occurs in 15% of patients. Adenocarcinoma, it begins in the glandular cells. These are found in the tissue that lines some internal organs and makes and releases substances like mucus, digestive fluids, and other bodily fluids. This form makes more than 50% of cases and is most commonly diagnosed in non-smokers. So ways to avoid lung cancer. Sorry, I thought I heard something. When choosing a lifestyle and trying to avoid diseases such as cancer, or more specifically lung cancer, there are things to avoid. Individuals that smoke are at a much larger advantage when it comes to avoiding lung cancer. Although it does not affect people that have never smoked a day in their life, it is still predominantly individuals that smoke that are receiving this diagnosis. Next, exposure to radon gas is a very large risk factor. Radon gas occurs naturally. It is a colorless, odorless gas that is dispersed rapidly outdoors, so it is generally not a health issue. But without the proper precautions, radon gas can enter through cracks or holes in the foundation of homes or buildings. Indoor exposure can be controlled with proper techniques, but it is hard to pinpoint an issue without getting a professional to check it out. So that is something to look out for. Lastly, long-term exposure to carcinogens like asbestos, arsenic, chromium, nickel, soot, or tar can drastically increase an individual's chances of lung cancer diagnosis. So, when you're trying to determine whether or not somebody may have lung cancer, there are different things to go through. First, you would do a primary screening, which is an overview of the patient's lifestyle choices and full medical history. If it is concluded that lung cancer is a possibility for this patient, then further testing will ensue. That would be the secondary screening. It includes a sputum cytology, which is a procedure where the patient gives a mucus sample to be tested, a chest x-ray, so just examining this and seeing deeper into the lungs, and if there are any like large white spots, that would be a good indicator for doctors that there's a problem. A low-dose spiral CT scan. This is a form of X-ray that uses low-dose radiation to examine the body in a spiral fashion. And a thoracentesis. This is a procedure done where fluid is removed from between the lining of the chest and the lungs and is examined and tested to see if there is indeed lung cancer in the patient. So this is Caroline Perez and her husband and their lovely family. Caroline Perez is a 66-year-old woman from South Carolina. She grew up surrounded by tobacco use and even around tobacco farms in the town's rural setting. She smoked her first cigarette at 16, then her use became more regular after she turned 17. Once she joined the Army, her tobacco use became even more frequent. She stated that if you smoked, you got to have smoke breaks. So at the height of my smoking, I was going through nearly a pack of cigarettes a day. She smoked for over 10 years, then became pregnant with her first child and quit. Although she quit early on into adulthood, she still received the diagnosis of stage 4 terminal lung cancer. Prior to her diagnosis, she thought she had a kidney infection. When she went to the doctor and did a scan to check for kidney stones, that is when they saw something off and opted for further testing. After more testing was done, Perez was diagnosed with stage 3 non-small cell lung cancer that had also spread to her lymph nodes. Following this, Caroline went through months of treatment involving chemotherapy and radiation in 2016. By 2019, the cancer had returned and she was now diagnosed with stage 4 terminal lung cancer. Although things did not happen the way Perez envisioned them, she continued to be a light and inspiration to others going through something as traumatic as this. So that's just a really good story. And then this, I didn't realize it was such poor quality, but this is Weston Fisher. He is a 5-year-old boy from Iowa, I do believe, and he has a rare unnamed form of lung cancer. When he was just 5 years old, he's already gone through 2 rounds of chemotherapy in hopes of killing his rare form of lung cancer. Weston's diagnosis is so rare it does not even have an official name yet. When he was 2 years old, doctors found a tumor on the side of his lung. After removal, he went through a round of chemotherapy and everything seemed to be good. Weston was exactly 1 year free of cancer when he once again went to the doctor and they determined it had recurred. Following another round of chemo, his family and doctors are hopeful but still very concerned. Because there is no proper research or even a name for the form of cancer he has, it is hard to say whether it will come back or not. Chemotherapy is an incredibly intense treatment to undergo for any normal adult, but for a 5-year-old, the doctors are concerned continuing chemotherapy will make his body too weak to fight it off. His mother is sharing his story in hopes of finding more answers to help Weston be cancer-free and to help any other child that comes along with this diagnosis. Incredibly sad story. To conclude, this was an overview of lung cancer. I hope that it was informative and somewhat entertaining with my misspeaking. Both of these articles are a prime example of what can be done to further educate individuals on the severity of lung cancer and spread awareness to everyone. So many people do not understand how deadly smoking and other lifestyle choices can be. Perez didn't understand the repercussions of her addiction when she began smoking at only 17 years old. She lived an entire life, served in the military, had her kids, got married, before the tobacco use eventually caught up with her. With that being said, it is also important to understand that cancer does not discriminate. It doesn't matter how old, young, the color of your skin, where you're from, the background, it doesn't discriminate at all. Weston was an overall healthy little boy before his diagnosis of a rare lung cancer at the age of 2. Thank you. Have a great rest of your semester.